Welcome, my name is Cornelius Musili Masila. I'm here to defend my research project entitled Harnessing the Potential of Community Health Promoters in Addressing Teenage Pregnancy and Sexual Reproductive Health Knowledge Gaps in No Ward, Kitui County here in Kenya. This presentation is meant for the partial fulfillment of the requirement for the award of Bachelor of Science in Health Science. For introduction purposes, that adolescent pregnancy remains one of the growing global public health concerns in marginalized communities, particularly in low and middle income settings, and especially in sub-Saharan Africa, and particularly here in Kenya. The high rates of adolescent pregnancy in No Ward, which is Nimwingi Central Sub-County, has contributed to low educational attainment and entering socioeconomic opportunities, and thus contributing to health inequalities. Therefore, this project is aimed at reducing adolescent pregnancy and promoting sexual reproductive health practices and knowledge among youth aged 13 to 19 years, which is hereby our target population, through a community-based intervention using the community health promoters. Adolescent sexual reproductive health is one of the serious global public health problems in underserved countries, particularly in low and middle income countries. The global statistics reveal that adolescent pregnancy is a major cause for long-term socioeconomic and health consequences among the younger people and their family, giving us the understanding that adolescent pregnancy is somehow or to some greater extent linked to social determinants of health. The World Health Organization 2021 showed that about 16 million girls between the age of 16 to 19 years and about 2 million girls under the age of 15 years give birth every year in low and middle income countries. A recent meta-analysis studies by Gill and Welbeck in 2023 revealed that an alarming prevalence rate of about 15.2% of girls get pregnancy every year in sub-Saharan Africa. So we want to understand what are the major causes of teenage pregnancy among the adolescent in these marginalized rural settings. And from our searches, we understand that structural inequalities such as poverty, as I mentioned earlier, that teenage pregnancy is closely linked to social determinants of health. Poverty, which is one among the structural inequalities, the legal systems of the frameworks of the countries, religious issues, as well as limited access to healthcare services, lack or inadequate safe spaces for sexual reproductive health services, as well as social stigmatization of adolescent sexuality based on the cultural norms and morals. Some of the major drivers of sexual teenage pregnancies. A recent study in 2017 by Gugi and colleagues revealed that lack of youth-friendly sexual reproductive health services and early initiation to sexual activities in Kenya are major predictors to teenage pregnancies. Therefore, community-led programs and peer educations can serve as effective intervention tools for improving sexual reproductive health outcomes, especially when we use the community health promoters. Why community health promoters? Because the community health promoters have the local competency. They also possess the ability to understand some of the social cues that the health promoters may not understand. So they have cultural competence in handling most of the barriers to save sexual health problems. We want to look at the research design and framework, and our research design and framework will adopt a community-based participatory research approach, and it will involve the result-based management framework, which incorporates or includes 5 aspects. And those 5 aspects are the input, the activities, the output, the outcomes, and the impact. And each of these aspects has a role to play in this particular intervention. The inputs will include the financial, material, and the human resource inputs, which will be translated into activities. And the activities shall include the training of the CHPs, conducting of the community outreaches in creating awareness on sexual reproductive health and campaigns among the target population. Our output will include improved knowledge and improved awareness on sexual reproductive health among the adolescents. And then we shall have the outcome, and our outcome will be reduced teenage pregnancies, improved access to healthcare services, a shift in behavior, and also proper utilization of contraceptives. So our long-term impact, which is actually the goal of this particular project, will be healthier and empowered adolescents populations, as well as decreased teenage pregnancies among the populations. This research project will adopt a mixed method approach for data collection and analysis. This is because the mixed methods are particularly useful in public health research. It allows for a more nuanced and comprehensive understanding of both statistical and lived experiences among the populations. The data collection technique will involve the use of the surveys, the interviews, and the focus group discussions. The sampling method that will be used is the purposive sampling for both the CHPs and the adolescents, which is our target populations. The quantitative data will be analyzed for percentage changes in knowledge and behavior among the target population, and the qualitative data will be evaluated to understand the thematic cues or the nuances that contribute to increased teenage pregnancies, such as the barriers, the attitudes, and the behaviors. From the study, our results indicated that there was improved knowledge, increased access to healthcare services, as well as positive attitude change towards contraceptive use and access to self-reproductive health services. Our findings revealed that the community health promoters are effective agents of change in addressing sexual reproductive health education. Also, we revealed that 75% improvement in understanding of contraceptive use and STI prevention. We also noted notable behavioral shift and increased uptake of sexual reproductive health services at local health services, as well as a significant improvement in sexual health literacy and a decline in teenage pregnancy. However, there were some challenges that we also came across, such as the traditional and cultural barriers, parental resistance, and logistical issues. Several factors that came across was about the use of stakeholder engagement, school partnership, and community dialogue were among the success factors. Our key findings or conclusion that we had was that the project demonstrated that targeted community-driven interventions can reduce adolescent pregnancy in rural settings. This project is scalable and adaptable to other rural settings, and that the CHPs play a crucial role in addressing health disparities. Thank you very much, and God bless you. These are the references to the work that I have submitted. And I want to acknowledge the guidance of Dr. Alok Kumar Firstaff for the dedication he has showed to me, particularly in addressing this particular project. Asante.